Dr. Kahan, sweaty feet and Botox, what do they have in common?
Wow, that's a good question, and I think there's a bit of controversy in the moment.
That's why I'm asking.
I understand. And to tell you the truth, I'm probably not well qualified enough yet, even though I'm a podiatrist and I deal with feet. There's still a bit of controversy out there, and we read about it in our podiatry forum. It was good, bad, short-term effect, long-term effect. Should we do it? Should we not do it? It's certainly not something that I'm participating in yet. And to tell you the truth, I don't know enough about it or have read enough to say, yeah, it's a good thing, it's a bad thing, but from what I have picked up from some of the conversation, there's evidently a lot of hope in that arena. I think the biggest problem is a matter of how much, how often, how frequent, and so on do the injections need to be done in order to have a lasting effect? Because it can be pretty expensive. On the flip side, we're talking 250, 300,000 sweat glands on the bottom of your feet, so there's no wonder that our feet smell, some people worse than others. And so I guess the long-term question is, or the long-term answer to the question is, how long will this treatment last, being a relatively costly treatment option? So that's really as far as I can go with it right now. I don't have enough information to really throw out a good educated.
That's why we talk to you, and that's why we want to talk to professionals. We're really not interested in what the establishment says. Well, at least I'm not. I'm sure I'm offending a lot of people by saying that. When I talk to people, and I'm almost sure that most of the patients out there, when they go to a guy like you, and for that much to a plumber for the plumbing, we want that person's advice, not the common, what we, so to say, read. And you obviously haven't engaged in it yet because at this moment you're not so sure whether it actually works the way it should, whether it might or might not have negative effects. You think it has perhaps some potential, but right now, from what you heard, you are not ready to engage in it as such completely, and your patients will completely appreciate that. And all that. Thank you very much.
Thank you.